Welcome to the Texas Conflict Coach radio program. If you've ever experienced or engaged in destructive or unresolved conflict, then you know it leads to broken relationships, distrust, and damaging results. Our program will help you manage and resolve conflict effectively with strategies, valuable resources, and support. Since 2009, our radio program hosted guest experts from around the globe sharing their perspectives, experiences, and expertise while giving you food for thought. If you can't listen live, then download and listen to any of our 300-plus podcasts in our library at texasconflictcoach.com. So sit back, relax, or join the conversation every Tuesday evening, or tweet us at TXConflictCoach.
Well, hello, listeners, and welcome back to our third episode of our Healthcare and Conflict series, Medical Misunderstandings, Narrowing the Physician-Patient Communication Gap. And we have with us Jetta Todoro. Medicine is more complex than ever, and the complexity is only increasing due to healthcare reform, new technology, new medications, complex treatments, to just name a few. Now, as healthcare continues its transformation, so will the relationship between the physician and the patient. Patients are finding that they have less time in which to present, discuss, or even follow up on a health issue. In addition, it's increasingly difficult to understand medical terms and treatment options. Given that time with healthcare providers is shorter than most patients prefer, it's critical to use that time wisely. But how? Given the constraints, it's important for physicians and patients to understand the challenges that each face. Now, Jetta will talk about how to maximize the use of limited time with the physician by using simple communication skills and techniques to avoid miscommunication and misunderstandings. Get solid, understandable information to maximize your healthcare experience. So who is Jetta? Her last name is Todoro. I'm probably mispronouncing that, but it's T-O-D-A-R-O. And Jetta is a mediator who's worked in conflict management and conflict resolution for almost 25 years, including dealing with healthcare issues. She has mediated patient-physician issues in the Texas Medicare Mediation Program, potential or perceived adverse or unexpected patient outcomes, physician practice issues, as well as private, nonprofit, and governmental, local, state, and federal issues. So a number of really broad range of things that she has dealt with. Most recently, she was a healthcare ombuds and mediator for Kaiser Permanente in Oakland, California. Jetta, welcome to our program.
Thank you so much for having me.
Well, so Jetta, first of all, why don't you affirm how you pronounce your last name?
It's Todoro.
Todoro. Okay, Very good. Thank you for clarifying that for me and for listeners. So, Jetta, tell us, you come from various perspectives and experiences in the work that you do, and it informs who you are and your passion for this work. So could you say a little bit more about those perspectives and experiences?
Of course. First of all, let me say that I really appreciate this opportunity to follow the last speaker, and anyone who did not hear the speaker last week, I would suggest that you go back and do that, because it was a great introduction to what I wanted to talk about, which was really getting into a lot of the how and what do we do when we're faced with some of the questions that we're going to be talking about. And my perspective, obviously, is from a mediator's perspective, and that is going into a conflict with two or more parties who are on various sides of the issue. They have various positions and interests, and going in as a neutral. Many people think that we're going in as either the advocate of an organization or the advocate of a patient, but we're going in as a neutral, and what we do is advocate for a fair process so that that communication is the best it could be. And I have discovered through the years that not only with my just normal, regular healthcare issues, but I have learned so much in myself, and then have been able to apply what I've learned professionally through a serious automobile accident situation in the 80s, as an educator teaching conflict resolution and communication skills, and then now most recently for the past 2 years as a caregiver, which I'm now going into in a much bigger way with my 93-year-old mother and a friend of mine who has a very serious illness. So I think it's important to note that most of the things I'm going to be talking about today, although I have observed them and I have helped people work through conflict by using some of the skills and some of the techniques we're talking about, I also have had more than one occasion to use them myself, and it's not easy, and I want to acknowledge that up front. I would say, first of all, it's not easy. Second of all, it's not impossible. And if you are having trouble, it's always good to get help.
Well, nothing like having real experiences ground you in the very work that we do, which is walking the talk, right? It's one thing to teach it, but can we practice and do it ourselves? Right. And so it sounds like you've been given some real opportunity in these difficult situations and challenging situations with yourself, your mom, your friend, in these types of communications and we could probably all learn something from you. And by the way, listeners, what Jetta was just referring to with the previous speaker, in case you're listening to this, 2 months from now, is Dr. Havi, H-A-A-V-I, Morreim, M-O-R-R-E-I-M. So if you're wanting to listen to that program Jetta was referring to, you're going to be looking for her program at the TexasConflictCoach.com. So, most of us, including yourself, have experienced being misunderstood or a misunderstanding from our conversations with doctors or other healthcare providers. And what misconceptions do both physicians and patients have that can make communication inadequate or even difficult?
Well, you are absolutely correct in that it is on both sides, and I think that's one of the most important things to remember, that one side may not be any prepared for a situation than you are, and giving people an opportunity to rise to the occasion is really important. First of all, I think physicians sometimes may have a misconception that a patient or a family member or a significant other can't understand the circumstances, the condition, the medication issues, the terms, or even the treatment options. And I think as a consequence, sometimes physicians, because of that misunderstanding, can fall back on using too much technical information, or they don't take enough time with the patient. And I think that it's good to caution physicians and to ask of physicians that they give you a chance to understand and that they explain things in words and terms that you will understand. I think another place of misconception as far as the MDs and the physicians are concerned is that sometimes physicians, and when I say physician, I'm talking about any healthcare provider. I'm not just talking about the MDs or the DOs or the dentists. I think that especially with now coming up against so many end-of-life issues and other critical issues at the end of life, I think that sometimes it is important to realize that they have their own biases, and they will come and, maybe they'll have a bias that you do as much as you can and then you just let a patient go, as opposed to going to any means possible to keep the patient alive. Sometimes people have kept patients alive in hospitals. Families have demanded that the patient keep that the doctors keep the patient alive, and the patient can end up being in the hospital for 2 years. And so, that they have some misconceptions. I think that maybe the patients and the families will feel the way they do about how science works and how the human body works and how a human being dies. And that isn't true. And so that discussion with the family to see where they are and overcome your own biases or your own tendencies is a really important one. And I think on the patient side, as far as misconceptions are concerned, many patients assume that the doctor is not going to listen, that they're not going to accept the patient's point of view or the family's input about something that has happened or possibly the history and how everything plays into, how one thing plays into another. They also make assumptions that the doctors are not paying attention. And one of my favorite things is to actually go back to something that I learned as a teenager or as a young adult from my father, who was a surgeon, and that is when a doctor walks into a room, a doctor is not only counting on the words on the paper that they have hopefully just read. The doctor can tell things from your eyes, from your breathing. The doctors are looking at the color of your skin. They're looking at your fingernails. They're looking, they may take your pulse. They're seeing whether you've got a hearing problem. They're seeing whether you can pay attention to something. And patients don't understand that. So there is an information gathering process with a really good doctor and it starts once they enter the room. One of the biggest complaints I've always heard is that patients just do not want the doctor to come in and ask them a question like, what brings you here? The patients think to themselves, didn't you read my chart? Didn't so-and-so tell you the reason why I'm here? And I've had patients just be adamant about the fact that the doctor was asking them questions about, tell me how you're doing today. Tell me what's been going on in your life. And they just make assumptions. They don't understand that the doctor is also doing information gathering at that time, seeing if you can focus, seeing if you can describe what's going on. Are you slurring your words? There's a lot of information that's gathered by the patient talking to the doctor, even if it's about things that the doctor already knows.
So, you say something that it reminds me of an episode of House. Have you ever watched that series?
Oh, yes.
So
yes.
Do you remember the episode where the doctor, I think it was a woman who was using an asthma inhaler, and he asked her, he was inquiring, asking her if she knows how to use it, and she was like, of course I know how to use it. You think I'm an idiot? Why are you asking me that? Which is kind of going along the lines of what you're saying. And the way he approached it was he basically said, could you show me how you use it? And do you remember what she did?
No, I didn't see that one. Tell me.
Oh, she sprayed it as if it was perfume on her body. She didn't put it in her mouth at all. She just sprayed it like behind her ear, behind each ear, like it was perfume. And, and of course he gathered information. So what is some of the challenges that physicians face in gathering and using patient information? I mean, obviously, patients who are resistant to having those questions asked, but they're trying to gather that information. What are some other challenges?
Right. Well, I think the one that is on everybody's mind these days is in terms of gathering information and using information, there is such a limited time. You hear patients constantly talk about, I only have my 15 minutes. And, many times that is absolutely true. My feeling about that, my belief about that is that if you know that you're only going to have 15 minutes, then you figure out how to use that 15 minutes to the best of your advantage. There are also challenges that doctors are facing about the best way to use electronic records. Everyone thought that electronic records were going to be just a wonderful time saver, et cetera, and in many, many ways there are, and the communication is much clearer because you don't have to worry about a doctor's handwriting. It can be more information than it used to be, but it's also difficult because one of the largest complaints is that patients will say, the doctor didn't even look at me. The doctor came in and sat down and went to the computer and asked me questions, and as I spoke, the doctor typed and said, thank you very much, and we never made eye contact. So that's another challenge. How can physicians and providers maximize the use of the wonderful technology that we have and yet make the patient-to-doctor contact, a meaningful one, and one that will provide information in the shortest period of time. And sometimes the fact that there are so many specializations now is a really, really big challenge. You go to a doctor and you think the doctor's going to help you, and they say, no, I'd like you to see so-and-so, and no, I'd like you to see so-and-so. And sometimes they're related to the organization that the doctor belongs to, and sometimes they're not. So you worry about the communication back and forth from office to office also.
Mm-hmm.
Another is that sometimes some doctors are not the best communicators. They're not the best advocates for a changing system. And I think that it's important to give feedback to someone about that. And there are many different ways to give feedback. But I think that physicians do need feedback, not only when they don't communicate well, but when they do communicate well. On the challenges on the patient side, I think there's a real lack of understanding of our healthcare system today, and a telephone call to the office before your appointment, if you have a question about what is going to happen before or what's going to happen after, is helpful. There is a lack of understanding about conditions and treatment, and it's important to make an effort to understand either, ahead of time or after, sometimes not to make a point of it to the doctor, but just to be familiar with terms. Just as a kind of humorous aside, I've heard a number of doctors say, I just don't want someone to come in and tell me that they need to get something done or I need to do something because they heard it on Dr. Oz. They're tired of hearing about Dr. Oz. They're a little bit tired of hearing about, I did my research on the Internet, and this is what I want you to do. There just are so many factors that a physician must take into account. One of those factors should be information from the patient about what they know and don't know, but not the demands. It's a little bit like the demands that so many mothers have made over the years when a child goes in with postnasal drip and they want an antibiotic, and so antibiotics were overused because of the demand of the general public for that. And we need to strike a balance in some of these things, and hopefully we'll be able to go back to that balance.
Well, let me tell listeners who are just tuning in or already been listening through the live radio program tonight that you are tuned into the Texas Conflict Coach Blog Talk radio program. And we're talking with Ombuds and Mediator Jetta Tadaro. We are talking about medical misunderstandings, narrowing the physician-patient communication gap. And, Jetta's already mentioned a number of misconceptions that physicians have about patients and misconceptions patients have about doctors, and these assumptions that we make not only, and also the challenges that we have, especially patients in gathering information so that they can use that effectively, maximizing the limited time we have in communications, and the challenges that patients face in being able to communicate clearly with their doctor during those limited times and understanding terms. So it's like you said, how do we strike this balance? So how do we start to ensure that the doctor has the adequate information to diagnose, not from Dr. Oz, but that he or she has the proper information to diagnose or propose a treatment, like you said, to strike this balance?
This is one where I will admit I have been doing this for the past couple of months, but specifically in the past 10 days. I've been practicing what I'm preaching. One thing is to assume, first of all, instead of think that the doctor is not trying to help, assume the doctor is going to help you. Not to be defensive, about being able to provide information. Assume they want the information. Another is to ask questions about the process of how to get information. Every situation is different. So if you have questions about the process in the office, if you have questions about the process of going from test to test to test. Go ahead and ask questions about the process so that you understand that. You may not use that in your 15 minutes. You may use that before or after, but don't feel hesitant about understanding the context in which you are getting this health care. The other thing is when I prepare for the meeting. And I had to even be reminded by a friend of mine to go into the meeting and state to the doctor what I want as the goal of the care, that the goal of the care is to stabilize X, Y, Z and to do X, Y, Z. That's what I want. That's what I want. Now, can you help me meet that goal? Otherwise, they don't know where you're going with this many times, and so it's really good to have those goals in mind. The second thing that I tell
and let me just clarify, Jetta. So when you say have goals in mind, you mean especially from the patient's perspective, but I would assume from the doctor's, because often I would imagine sometimes the goals might be different.
Absolutely, and that's why the patient needs to be able to express those goals. For instance, my goal is to keep my mother in her own home for as long as I possibly can. She's 93. Her great-grandmother lived to be 97. She's got long-lived or lived family members, and my goal is to keep her at home. So help me do that. Let's look at all of the different things that we need to do in order to do that. That is a whole lot different than someone who has the goal of, say, I want to put my mother in a nursing home. I want to bring someone into care for her. It's just good to have your goals clear, and it's good to have your goals stated. The next thing I'd say to do is to make notes of what you want to tell the doctor. I have never gone to my primary care physician that I didn't have a note of 3 or 4 or 5, however many things that I wanted to tell the doctor, that I wanted the doctor to take note of. I learned that being a second grader going to confession when I was in Catholic school, and I would write my sins on the palm of my hand before I went in to see the priest. I was really prepared for what he needed to know. And it's the same way with your doctor. You don't want to forget anything, and believe me, you will forget something if you are not prepared with your notes. And it doesn't have to be pages. By notes, I mean one word, allergies, one word, to remind myself that these are the things I want to tell him about or ask about. And also for him to be sure and put in the record, because as you know, records get transferred from doctor to doctor, and you want to make sure that things are in the record. And there are times when you may have a timeline of something or a progression of something that you want to give them so that they can put it in the record. Many doctors still keep written records. They still have folders for patients, even though it's not the comprehensive folder. And there may be something that you want to keep for them to keep. Another thing.
Now, before you go further, let me just clarify something for listeners. With the new electronic records, even as patients, I get emails all the time. Go log into this new healthcare portal, and you can see your records and and check in and all of that kind of stuff. So, these new electronic health portals, are patients able to see that these things are logged into their notes properly, or is that something different altogether?
I would think that is something a little bit different than I'm talking about, and what I believe is that different systems do it differently. I was just in a system where your electronic record, you had access to it from home. Well, you didn't have access to everything from home. You had access to summaries. You had access to results, et cetera. Now, you do have access if you want to go and get a CD of your complete medical record. That's different than something that you might be able to see at home. So I would say when we're talking about that, check to see how much detail there is and check to see where that information is kept.
Gotcha.
Yeah. Now, the other thing is, since you're taking notes or giving notes or whatever, it is very important to be concise and to be specific. If you want to illustrate something to the doctor, don't tell them a really long story. give it to them straightforward and factually and, as quickly as possible. Don't skimp on the information because you want it to be complete. But be sure to not take up too much time, and then you don't have time at the end to say some really important things, because sometimes we leave the best for last. Another is be very prepared to ask questions. And if you write down the questions that you want to ask the doctor, practice with someone else that you trust if you have that capability, so that you can hear how the question is asked. And one of the things that I tell people is, this is something I was going to say a little bit later, but I'll say it right here also. When you prepare to ask questions, ask how or what questions, what or how. How is that going to impact my long-term treatment? What is the meaning of that word? What is the difference between this and that? Not do I do this, do I do that, because you'll get yes, no, very short answers, what we call closed. You don't ask closed questions. Ask open-ended questions, so that you are, by virtue of the way you're saying it, you're inviting the doctor to give you more rather than less information.
So far you've given a number of great strategies and tips for how to close that gap, between the physician, and as you mentioned, a physician could be any healthcare provider, not just the, MD. Right. It could be the nurse practitioner, the physical therapist, whatever that might be. And there's a number of things that, just kind of a little bit of a summary as we start to wind down on the program is, first of all, making sure you check your assumptions about, the physician, the healthcare system, any of those kinds of things. And by doing that, you're preparing, as you said. You want to be clear about what your goal of care is, whether it's for yourself or, like in your case, your mother, or maybe a really good, good friend, and making sure that you're on the same page as a doctor, especially if his goal is different than your goal. Making lots of notes, but making those notes very concise, clear, factual, maybe even in a timeline, orientation, making sure that whatever notes or decisions that are made between the two of you are made in your record. To write questions that you want to ask, practice that with a friend or a spouse, and using those how or what open types of questions. And, of course, and this probably goes without saying, is kind of taking notes on the answers that you hear, so that you don't forget, what was either said, or even if you take notes and you're like, wait a minute, I remembered this a little bit differently, can I follow up, maybe not with the doctor, but maybe the doctor's nurse or the doctor or the healthcare provider's assistant of some time. Now, one of the questions I wanted to ask you is, what if you are doing a lot of these things and the doctor is still not listening and he's not attentive? Do these strategies and tips overcome some of that, or is there something else specific that would help that?
Well, I think they help to overcome it, very definitely, because it is all about you engaging the doctor or the healthcare provider, and the doctor engaging you in your own medicine, in your own health care. I think that if there is that problem, I think the first person to tell is the doctor himself or herself. Doctor, I felt uncomfortable in our last meeting because I'm not sure that you heard what I said. You can always say, I'm not sure that I explained it the way that I wanted to explain it as I thought back over it, and I would like to do it again. Or you can say, Doctor, I really feel right now like you're not listening to me. You're focusing, more on getting down what I'm saying. Could we have a conversation about this instead of just me talking to you? So asking for what you need. You need the doctor to listen to you. You need to, make eye contact. You can say, I used to tell patients, too, if they were going to a new doctor and they had told me about complaints they had of former doctors, I'd say, it's really good to start out with. The first thing I want to start out with, doctor, is that I have had some experiences in thinking that doctors have not heard what I've said. So I would like for you and I to have conversations about, what I've said and what I understand so that there are no misunderstandings. So you just put it on the line. This is what I need. You could say things like, when you don't look at me or touch me, I heard on NPR a physician from Stanford about 6 months ago do a wonderful program about his belief that too many doctors are not touching their patients. And one of the things that research has found is that patients want the doctors to touch them. They feel like if they're not close to them or touching them in some, taking their pulse, stethoscope, whatever, looking into their eyes, taking their hand and looking at their fingernails, or even looking at an incision, or they feel like the doctor is not attentive if they are not looking at whatever it is, if it's visible. And so he's talking about the importance of touch and not only to gathering information, not only but also in gathering trust, the trust of the patient. And again, you can say, here are my goals for today. I want to make sure that you have heard what I have said, and I'd like for this to be a discussion, and I have some questions at the end. It is really all about setting up a relationship, and if you believe that half of that relationship is not happening, then you're not going to be satisfied. And this is where I'm glad you mentioned it, but this is where I was also going to bring up making notes. Always make notes. You will not, more than likely, remember the instructions the doctor gave you, the number of milligrams, or the medicine, or whatever that you were going to take. Don't ever hesitate to take notes in a doctor's office. It's critical. And if you have a question about it, you can then say to them, "Doctor, you just said," and then you quote what they said. What does that mean? Could you tell me what that means?
Mm-hmm. Oh, absolutely. But there's something that you're saying in all of this, that there's a hesitancy, a resistance, an anxiety, a fear. I don't know what it is for a lot of patients who put those healthcare providers on a pedestal, their God, okay, or their whatever. You listeners, you have your label, right? And so then they don't ask the questions. They don't take the responsibility to set that up as an equal. Maybe equal is not the word, but that relationship that says it's okay for me to say to my doctor, this is what I need, this is my goal, and not to be fearful or resistant or anxious about engaging in that kind of a relationship, because this is your body, this is your life, this is your health. And so a lot of that ownership needs to be on you to make sure you're communicating that in a way that he or she can hear. And that you're communicating that goal and not making assumptions that the doctor understands that. So I don't know.
Not being demanding.
Exactly. Like not doing the opposite of the pendulum, right?
Right.
You go from not saying anything to just pouncing on the doctor.
Right. Phyllis Critic has written very articulately about what some people call the uneven table in mediation. And I think we have to face it. When we go to see the doctor, we believe we are sitting at an uneven table. We still we know that this person knows so much more than we do. As far as information is concerned, as far as expertise is concerned, it is an uneven table. And we need to start there. Having said that, when I was mediating between doctors and patients, my job was to make that table as even as possible, meaning make it a fair process, give people equal time, make it comfortable so that people can ask questions. And I'm talking about the doctors can ask questions, and I'm talking about the patients can ask questions. And we need to remember the same thing for us. I even feel like that when I go to talk to a doctor who knows a lot about something that I do not know. We're not here to talk about what I know. We're here to talk about what's going on with me and what they know that might be able to help me. So the way you make it more of an even situation is that you recognize that this is a relationship that has to be worked on from both sides, because we are no longer going to just take most likely take facts and take actions without having questions. And the way we learn things is to ask questions. So the old how and what questions, and it really puts us in a position of trying to even up the discussion. If we can't have an even table, but we can have a more even discussion.
Oh, absolutely. I love it. I love, what you're saying about that uneven table and how do we begin to understand and recognize and realize that we need to work it from our side as well. And certainly, find, physicians. And there's a lot of physicians that are out there that, as you said earlier, are not the best communicators, and they need feedback. I remember one doctor in particular needed feedback, and me being a conflict coach and mediator myself, I'm like, I need to walk my talk. And so I started this session off by saying, before we begin, I really need to have a conversation, and what I really need you to do is really hear me and understand. And he put everything down. He put his pen down. He put his chart down, and he just listened. And I was very quick. I said what I needed. I had already practiced what I was going to say, what my key message was, and without blaming, I wanted to make sure he could hear it and then ask any clarifying questions. And he was very approachable. Once I kind of, not that I warned him, but that I set the tone to allow him to be able to engage with me that way. But it took practice, and it took preparation, and it took me being clear about my goal, and it took me clear about being having a concise message. All of these strategies that you said, and when you do that, it makes it so much easier.
Well, and I hope the listeners pay attention to the fact that they have had two professional mediators tell them that they write things down and that they practice them. There's nothing wrong with that. This does not come easy to anybody who is in the situation at the time. And being aware of those things is really critical.
So, Jetta, I know we're coming to our close now. It's so fast, these programs that go so, quick, but we have such valuable, wonderful information, and I appreciate so much you sharing from not only from a personal experience, but from your professional expertise, experience as an ombuds, as a mediator. What is one, and you've given a lot of strategies and tips, but what is one thing right now that you would like to ask listeners to take the next step on?
Well, I think, but before I do that, let me say one thing, and I'll come back to the next step. One next step is to be ready to say to the person you're talking to, I need help. I don't understand what's going on. I need clarification. Could you explain this to me? I have used that 3 times with 3 different healthcare providers in the last 10 days, and I have gotten incredible responses because people want to help you. If you go in like you know everything and you're demanding something because you think that's the way to do it, that the squeaky wheel, I just don't think that works in a tense situation like this, in a potentially conflictual situation that is high stakes. So, to go in and to say to somebody, I really need your help. I don't understand this. I know a little. I said to somebody today, I know just enough to ask wonderful questions, a lot of them, and to be dangerous. And what I need is help from you to understand what this situation is right now. And I have just gotten incredible, responses from people from whom I've asked for help. So I just wanted to say that. Now, the other thing in terms of what they can do, one thing that I would do is think about the next time you need to go to a doctor. It might be tomorrow. It might be next year when you have your physical. But think about what you would really like to know from your next doctor's visit and what you really want to tell your doctor. That's 2 things. What you want to know from that doctor, I need these things, and what you need to tell your doctor about certain things. And I would also suggest that you write down 2 or 3 questions you'd like to ask the doctor, especially beginning with what and how are open-ended questions, because, again, that invites them to, linguistically, in their brain, it invites you to, it invites them to give you more information. And then another thing is, don't forget to ask for other resources. What are some other resources because I know that you're busy, what are some other resources that I can go to that you think are credible where I could get some more information about this? And I think that if you do that, you'll be just really many steps ahead in terms of being able to manage your own health care.
Wonderful. So some great next steps, listeners, that you can take immediately, especially if you've got a doctor's appointment tomorrow or with your healthcare provider. So
That's
very
right.
good. We want to encourage people to take the next step once they listen to a program like that, and really encourage them to commit to that new way of doing something, even if it's just one thing. So very, very good. How can listeners best reach you if they wanted to reach out and talk to you some more about this? What would be the best way for them to do that?
They could call me on my cell phone, which is 512-971-1973, 971-1973, or they could certainly email me. And my email is Jetta, Jettat, at, and then my name, Jetta Tadero, with mediation behind it, JettaTaderoMediation.com. And I will get the email, and I can get back to them, and then maybe we could even set up a conversation if they wanted to, have a face-to-face conversation also. I think one of the most important things to remember is that we feel like these people have a responsibility to us because they are the experts. They are being paid to do something for us. We are using our hard-earned money for them to do that. But I think that I want everyone to remember that we have an equal responsibility in establishing that relationship, and we have an equal responsibility in making that relationship successful.
Very good. Well, I want to thank you so much again, and listeners, again, that email address is Jetta T, that's Jettat, like in Tom, at Jetta Tadaro, Jettatodaro, mediation.com. Did I get that right?
You got it.
Okay. And Jetta, I know you said, was there any other burning comment or that you want to make at this point before we close?
I think practice, practice, practice.
That's very good for all of us, including
all of us.
us. Always, always, always.
I practice. I write down those questions, and I practice to make sure that I've gotten them so that I'll get the kind of information that I'll need.
Great. Well, Jetta, thank you so much for being part of our Healthcare and Conflict series and for sharing your experiences, your expertise, and the numerous numbers of strategies and tips on how we can narrow that gap between physician and patient. Absolutely. Thank you and good night.
Thank you so much. Good night.
Thank you for listening to the Texas Conflict Coach. We hope you've enjoyed the program. You can find over 300 podcasts archived to listen at your own convenience at texasconflictcoach.com or download the podcast at iTunes or Stitcher Radio. To learn about upcoming radio programs and resources, sign up for our monthly e-newsletter.